Hi everyone, this is a lesson on the signs and symptoms of type 1 and type 2 diabetes. Presented by Mustafa El Aroufi at Ibn Tufayl University, Faculty of Science, Kenitra. Before we get into the signs and symptoms, let's talk about diabetes. Diabetes is a metabolic disease characterized by chronic hyperglycemia, blood glucose level greater than 1.26 g/L or 7.0 millimoles per liter. The first person to describe diabetes in detail was Ibn Sina, Avicenna, in the year 1037. He described the symptoms of diabetes and distinguished between two types of the disease. In 1052, the medical text Kitab al-Quantum al-Tib was written, contributing further to the understanding of disease processes. Later, in 1838, Apollinaire Bouchardat chemically identified glycosuria, sugar in the urine. He promoted the use of diet and physical activity in managing diabetes, and was among the first to suggest that the pancreas was the root cause of the disease. In 1931, Homer William Smith first described tubular reabsorption of glucose in the kidneys and its role in maintaining carbohydrate homeostasis. Regarding the progression of the disease, we observe from the document a sharp increase in the number of people suffering from diabetes, from 110 million in 1994 to 300 million projected in 2025. There are two types of diabetes. Type 1 diabetes is caused by the autoimmune destruction of the pancreatic cells responsible for insulin production, specifically, the beta cells of the islets of Langerhans. The disease typically appears when only 10 to 20% of functional beta cells remain. Antibodies produced by the immune system target antigens on the surface of beta cells. This antigen-antibody reaction, combined with a direct attack by killer T lymphocytes, leads to the destruction of these beta cells. This process results in an absolute and permanent insulin deficiency, which causes chronic hyperglycemia. Because the pancreas can no longer produce insulin, the survival of patients depends entirely on daily injections of the hormone, hence the name insulin-dependent diabetes. Type 2 diabetes. In individuals with type 2 diabetes, many islet beta cells undergo apoptosis, and the function of the remaining cells becomes impaired. This results in a significant reduction in circulating insulin levels. Additionally, insulin resistance in peripheral tissues hinders insulin's action, leading to reduced glucose uptake from the bloodstream. This occurs due to a decrease in the translocation of GLUT4, a glucose transporter, to the cell membrane. The combined effect of reduced insulin secretion and insulin resistance results in hyperglycemia and hyperlipidemia, along with other symptoms typically associated with type 2 diabetes. And also we have gestational or pregnancy diabetes. This is a temporary form of diabetes that occurs in pregnant women who are not diabetic before pregnancy. Between 2 and 5% of pregnant women are affected. 3 factors contribute to its onset: age, excess weight, and a history of diabetes in the immediate family. Appears during the second and third trimester. Exposes the fetus to complications. Exposure to type 2 diabetes within 10 years if overweight. Risk factors for type 2 diabetes include family background, poor diet, lack of physical activity, being overweight or obese. The etiology of type 2 diabetes involves both genetic and environmental factors. Contributing elements include overweight and obesity, a sedentary lifestyle, and a diet rich in carbohydrates and high in lipids. Additionally, increased sensitivity of adipose tissue to insulin leads to an elevated rate of insulin production, which over time causes insulin resistance. Insulin resistance is a condition in which the body's cells no longer respond effectively to insulin. As a result, the liver increases glucose production, muscles reduce glucose uptake, and adipose tissue releases more fatty acids. This metabolic imbalance leads to elevated levels of glucose and fatty acids in the blood, a condition known as glucolipotoxicity, which further worsens diabetes and other metabolic disorders.